Me Medicine Cram Acyanotic Heart Disease Flashcard Set 23 Ventricular Septal Defect Patient Discharge. Okay, let's just cover a little bit of background before we get into the crux of these cards. A ventricular septal defect, as shown right here, is a defect in the ventricular septum. The ventricles of the heart are always inferior to the atria. Okay, here we see a normal heart. Here we see a VSD. And the septum, the ventricular septum, is the wall, obviously, that divides the left and right ventricles of the heart. And this is exactly why a VSD is classified as an acyanotic heart disease, because these are a group of diseases where deoxygenated blood mixes with oxygenated blood in the heart. And we can see from here that that's going to be the end result of a VSD. Okay? So this deck of cards can be used for review for the National Council licensure examination. The healthcare provider is planning the discharge of a child with a ventricular septal defect. Which of the following is a priority to include in the discharge instructions? Is it A, provide instructions on monthly immunoglobulin shot during RSV season? And in case you forgot, an immunoglobulin, I always get tongue twisted with this and many other medical terms. An immunoglobulin is, well, in biochemistry, it's a class of proteins present in the cells of the immune system of organisms, and they function as antibodies, okay? And RSV is short in medicine for respiratory syncytial virus, and it's a virus, specifically a paramyxovirus that causes the disease of the respiratory tract. The major ones that we're most familiar with is bronchiolitis and pneumonia in young children. And it's also thought that this is a major contributing factor in sudden infant death syndrome. So, hey, this this kind of sort of seems like the answer already because we're dealing with a child in the question stem. But let's look at the other priorities. B, ensure the parents know how to take the child's blood pressure at home. C, advise the family on how to provide meals that are low in fat and calories. Or D, suggest quiet activities for the child to decrease physical activity. I'll give you a moment to select the correct priority to include in discharge instructions, okay? All right. Okay, so let's dissect some of these priority options. In general, children with VSD don't need to restrict their physical activity. Therefore, answer choice D is out. And even asymptomatic children with small congenital heart defects tend to experience poor growth patterns due to increased nutritional needs. So meals should be planned accordingly. Therefore, their diets might have to be up in fat and calories rather than lowered. So answer choice C is out as well. And because of increased pulmonary blood flow, children with ventricular septal defect are at increased risk for pulmonary infections. And RSV is a type of pulmonary infection, as I explained earlier. It's respiratory syncytial virus. So you would definitely want to instruct the parent on how to administer immunoglobulin shots to prevent this type of infection. So the correct answer choice would be A, provide instructions for a monthly immunoglobulin shot during RSV season. All right.